Hi, good evening, everybody. So, welcome to tonight's talk on fatty liver disease, or more importantly, how not to get fatty liver disease. So, basically, fatty liver disease is one of the most common liver conditions in our country right now, partly because of the staggering rates of obesity, which are sweeping across the nation as well. And there's something to be said for which came first, the obesity or the liver disease, or vice versa. And it doesn't entirely matter which one originated. The fact is they tend to go hand in hand. So right now about 70 million adults have some degree of fatty liver disease. And that's about 1 in 3, if I remember right, of Americans that are being affected by this. And some of the main things in the diet that contribute to this are, number one, more calories going in than are being burned up. So excess calories is a huge one, regardless of where those calories are coming from. More specifically, certain forms of calories are more likely to deposit fat in the liver for various mechanisms and reasons. One is high saturated fats. So that means fat that's coming from animal products, dairy products, and some of the other processed foods in general are particularly likely to accumulate fat in the liver. Sugar. There was a study that showed that 1 can of soda a day increased the rates of fatty liver disease by 45%, which is a lot. So even something as simple as having some saturated fat in the form of something like chicken nuggets per day, they found that folks who had about 14 chicken nuggets worth of meat per day had triple the rates of fatty liver disease compared to those that only had 7 nuggets per day. So there is something to be said for the amount of individual foods that are associated with this fatty liver disease. There are a few foods that are particularly protective in general for the liver. In general, the whole food plant-based diet pattern that I talk about throughout many of these video presentations is an overall global reducing effect on it, because it's reversing some of the metabolic conditions that led to the fatty disease in the first place. But in addition to that, there are some other foods that may be particularly helpful. Cruciferous veggies, and that's a big fancy word for saying broccoli, cauliflower, and kale and arugula, and a few related vegetables as well. Those are the cruciferous vegetables. Broccoli is well known for its detoxification effects. We'll do more video probably on that later as well. Amla powders, so that's the Indian gooseberry. We've talked about that previously. Dr. Greger just did a great presentation in the past week about the effects of amla, or Indian gooseberry powder, on its effect at lowering cholesterol. Whole grains in general are very protective for the liver, chlorella, and again, broccoli. There's another study on purple sweet potato juice and its effects on the liver as well. So basically, there's some evidence that some bright purple and blue colored foods, naturally occurring, not the synthetic petroleum stuff, but things like blueberries and purple sweet potatoes and blackberries, those acanthocyanins, those purple pigments, are especially good for the body in many directions. So back to the non-alcoholic fatty liver disease. So why is it, and why do we care so much about it? Well, the liver is one of those organs that does a lot for the body. In other words, it's our main detoxification system, and it pretty much processes not quite every drug or every morsel of food that goes into our system, but pretty darn close. So there's a lot of things that we can do to help enhance liver function, like, for example, the broccoli in the diet is a very good thing to have on a regular basis. But the trouble is that when this fatty deposit gets into the liver and stays there for a long time, well, it can start to impair the body's ability to detoxify some of these things, but more importantly, it also can lead to people developing cancer over time. So building up of fatty deposits in the liver leads to non-alcoholic fatty liver disease, susceptibility to disease, and then over time, if it goes on for long enough and isn't reversed, then liver cancer, hepatocellular carcinoma, or HCC, can be the result. So what are some conditions associated with this? Over 70% of people that have this condition have obesity going on. So most people with this are between 10 and 40% heavier than the ideal body weight. And up to 75% of people with this non-alcoholic fatty liver disease have type 2 diabetes. So in other words, insulin resistance, diabetes are very, very closely linked, along with the impact on the liver. So as the liver gets fatty, it starts to spill over triglycerides into the blood, which sometimes when we're measuring these things, you can actually see as people's health improves, that triglycerides that's very high, the waist fat goes down, and also the triglycerides tend to drop at about the same time as the insulin resistance or prediabetes and similar kinds of things get reversed. It's actually very nice to see it all together. Dr. Gary's got a great presentation on that, which I'll share later, on the interconnectedness between these things, some of the latest science on it. So insulin resistance, again, very similar or very frequently goes along with the fatty liver disease. And then there's a few drugs in particular that have been linked to this. So synthetic estrogens have been linked with it. Pesticides that are toxic to cells have been linked with it. So some of the pesticides we might be exposed to. Good reason to find different methods to clean off your produce, in other words, to get rid of some of those extra pesticides. Amiodarone is a very common medication that's been linked with NASH. Tamoxifen, something that women use sometimes to prevent breast cancer. And a couple other ones. Steroids are a very common one out there, especially when people have autoimmune conditions and they need to use steroids sometimes to help control their immune system. Those steroids can impact on the liver as well. So most people with this fatty liver, no symptoms whatsoever, hardly know that they have it. Sometimes you can see a small elevation in liver enzymes kind of over time. And oftentimes that can be happening for years and years and years before we get a ultrasound to confirm the diagnosis. So basically, the other thing that can cause liver damage, of course, is also alcohol. So when we're distinguishing the two, usually the non-alcoholic one, people tend to not drink as much alcohol as the ones that have the alcoholic liver damage. Kind of, I guess, goes without saying on that one, but it's actually very important that when somebody has liver damage in the form of fatty deposits in the liver, alcohol intake of any sort can actually make it much worse. And so for that reason, we actually recommend strictly staying away from alcohol when you have this non-alcoholic fatty liver disease. Also, protection against hepatitis. So if somebody has this and they've not gotten their vaccinations yet, highly recommend hepatitis A and B vaccination, both. Someday, hopefully, we'll have a C, but we don't have it quite yet. So hepatitis A and hepatitis B vaccinations. Hep B is a 3-part series. And testing folks that are born between, I think, 1945 and 1965 for hepatitis C is now a very common practice as well, because hepatitis C plus fatty liver is also a much greater risk for liver cancer directly as well. So weight loss has been suggested to help with reducing not just the weight that's around the belly, but the weight that's inside the internal organs, like inside the liver, inside the pancreas, inside the muscle cells themselves. But part of the tricky part about this is, of course, when somebody has insulin resistance, their body is not processing the calories, it's not processing the sugars as well as it used to. And so that alone is a barrier for people to lose weight. So that's one of the reasons why going back and reviewing those pre-diabetes presentations that I did the other summer can be a very helpful step, because as people get more whole food, plant-based, no added oils foods into their life, and a greater percentage of their diet becomes this, then the faster you're able to get rid of that insulin resistance at the root, and then the weight loss really starts to happen a lot faster and a lot more directly, because you're getting rid of some of those root causes of these issues. Some people have suggested vitamin E as something to have to help with liver disease. The trouble with some of these supplements is that when people take vitamin E supplements, sometimes that can increase mortality. In other words, when people are taking these things thinking that it's going to be good for their health, in many studies, like for the impact on heart disease and other things, basically they end up dying sooner and having more problems and such than if they had left those supplements alone in the first place. On the other hand, having some foods once in a while that are rich in vitamin E, such as nuts, for example, that puts in the body in a form that the body knows how to process, and may in fact have a little bit of protection against the fatty liver as well. There was a presentation I saw recently from Dr. Berger that was suggesting that when people are eating meals and they have a handful of nuts with it, it helps prevent some of those spikes in insulin and spikes in blood sugars and such, and it gives it a little bit more of a blunted effect on there. Because when these things are spiking, then it also pretty much immediately drives fat into the liver. Alcohol pretty much immediately drives fat into the liver. The way that the body detoxes the alcohol turns it into fat directly in the liver. So again, staying away from alcohol when you have fatty liver disease is a vitally important point. So the other most serious complication of NASH, besides liver cancer, is cirrhosis. So liver cirrhosis is when the liver becomes severely scarred, and it is a terrible thing to experience. And basically, the patients that I've seen that have had this in the past, it can be very uncomfortable. They tend to develop fluid retention in the belly. Sometimes they can't detox some of the pigments from the blood, the bile, and such. And so these breakdown products that the liver doesn't quite detox essentially turn them yellow. You can sometimes see it first, most sensitively in the eyes, and sometimes you can also see the complexion become yellow as well. And so that liver cirrhosis does happen when about 8 and 26% of people that have NASH. In one study, and then the older women with diabetes are at higher risk of developing that liver cirrhosis. So it's very important to prevent this particular disease. So I guess key points: fruits and vegetables, really good for you. Maintaining your weight in to a normal weight as much as possible over time. A couple other the risk factors that are a little bit more rare. The high cholesterol kind of goes along with the fatty liver as well, just in the fact that people are eating it, plus the way that the metabolism goes with it as well. This one doesn't apply to that many people, but when people are taking IV feeding, in other words, they can't use their stomach and they're reliant on IV feeding to supplement their body, that can also trigger it. Talked a little bit about the drugs. Occasionally it can happen during pregnancy as well. So that's pretty much what I have for you guys on fatty liver disease. Again, a lot of very simple things where this one whole food plant-based diet can make a huge impact on helping to prevent this particular condition, but also can be a key role in helping to reverse it and to change some of those things back. Obviously can't necessarily, if a part of the liver is scarred down and completely broken to some degree, I don't have the tools to regenerate a broken liver, but the liver itself does have some capacity to regenerate itself, which is pretty darn cool, if you ask me. So, anyway, thank you all for joining us tonight for this little talk on fatty liver disease, as always, check the comment sections below, and we will go ahead and have the references available for you so you can read further on it. All right, thank you. Have a good night.